deadly coronavirus.
Coronavirus is killing Black Americans.
It was not that easy to go out and get the street quiz going because, again, social distancing. So we're social distancing here at Africa 101, so you should be doing the same. What we have been able to do, though, is get videos from people across the continent.
My name is Kehinde from Nigeria. I'm a filmmaker. We are undergoing the second phase of lockdown of the 28 days lockdown in Nigeria, and it's been really crazy.
Olá, eu sou Nicolau Miguel, sou de Luanda, Angola. Com o desafio global do Covid-19, o estilo de vida da minha cidade, Luanda.
My name is Brent from Ghana, Accra, and so the coronavirus has really impacted us here in Ghana, and currently the country is under partial lockdown.
As it is, we're sitting at 382,000 cases worldwide that have been confirmed, and we're looking at 16,000 deaths globally. Getting more specifically to the African continent, we're looking at 1,400 cases. We're going to be looking at the coronavirus, where it's at, how prepared is Africa, and what is Africa doing to coordinate its strategy through the Africa CDC and also through multiple partners. What the African Union is doing, what member states are doing, and what each region on the African continent is doing, and how all of that is coordinated. So welcome to the second episode of Africa 101. As the coronavirus rages across the world, there's a lot of concern on its impact on the economies and everything else. But before we get into all of those topics, let's just get into the history of outbreaks, especially here on the African continent. As you might remember, the Ebola crisis that hit West Africa. The Ebola crisis 2013-2016, 11,325
several remote areas in the country.
And this is
but there are also numerous cases and deaths in the capital city of Conakry.
Pandemic, which has so
the
far
World Health Organization has
lives globally, and comparable to the situation we're in because of the differences between the diseases and how they're spread, and also the preparedness. Back in 1976, many countries were not in any position to coordinate, as we've seen the coordination spearheaded by the African Union and a detailed strategy for all the 55 African nations. We have to look at why it's so different now and why the preparedness is much better to dealing with such a pandemic. So this means that we'll be introducing you to another one of the organs of the African Union, which is the Africa CDC. The Africa CDC is headed by Nkengasong, who is essentially the man at the center of the storm, trying to, again, effect this continent-wide strategy to prevent and to minimize the harm of the coronavirus, both to human beings, to the economy, and also social disruptions. In an interview that he had on the 20th of March, he made it very clear that we do not have enough resources as a continent to deal with this issue, which is why there's this concerted strategy across the continent to either contain and prevent the spread of the virus and also minimize the harm to the very fragile economies of the country. So, given that Africa is struggling with the resources to contain such a disease, one thing that has been very vital to point out is when the first case was reported on the 14th of February, only 2 African countries had the ability to diagnose this disease. And that has so far gone from 2 to 48 within a month because of coordination with the African Union and through the Africa CDC. And this now brings me again to the help and support that the African continent is getting from outside of the continent. Yes, I know that is always a contentious issue, but in a time like this, the politics of that such help is usually the last thing we should be worrying about. What we should be concerned mostly about is how do we prevent this from affecting the very fragile health systems of the continent. And so far, one big contribution to the fight against the coronavirus on the continent has been through the Balla Foundation and Jack Ma, who has provided 1.5 million test kits and equipment for medical professionals across the continent. Before this donation, however, the Africa CDC had already been able to distribute 70,000 test kits. The African Union has an Africa Joint Continental Strategy outbreak. So the 6 technical groups are focused on surveillance, infection prevention and control, persons with severe COVID-19 infections, and then there's laboratory diagnostic and subtyping, and then there's risk communications, supply chain and stockpiling medical commodities. These 6 technical groups work hand in hand with each regional economic community to better align the strategies and the solutions to that particular situations. What can you do to keep yourself safe in these situations? The World Health Organization suggests regularly washing your hands. Still struggle with basic access to water. So you can imagine if one of the most effective ways of containing this outbreak is washing your hands, how that could be difficult for rural communities and poor communities in urban centers who do not have good access to sanitation and water. Refugee populations and people who are internally displaced, who again do not have proper access to water. Major challenge for the African continent is going to be the economics of it all. Social distancing is one of the most effective ways of preventing the spread of the disease, but social distancing is going to be very difficult if you are dependent on your daily income for survival of your family, because that means less money going into getting food for your family. If you're a small trader, it is going to be absolutely impossible for you to contend with these challenges. This is a part of the economy that's already been impacted. These are traders who mostly do business with China, because as soon as the outbreak hit, these were the first people to suffer because they couldn't travel to China for their business, and we have seen how this has completely decimated their incomes. Social unrest, and how this can be triggered by either shortages of food, shortages of medical supplies, or shortages of water, or other existing situations already on the continent, and how these could translate into another set of challenges that the African continent would have to deal with outside of the outbreak itself. Which is the... Okay, so to wrap up, we've introduced you to a very important organization called the Africa CDC, which is at the forefront of coordinating Africa's response. Africa has a whole field of experts who are working with other experts globally to coordinate this response to the outbreak. So your country is not alone. There's other African countries and other Africans who are working hard to ensure that this situation does not devolve into chaos. We have highlighted the unique challenges that the African continent faces in as far as our mostly vulnerable populations, which are people who already are living with certain conditions, and small communities that do not have access to certain infrastructure, and also the economic challenges that the coronavirus presents to the African continent, especially in this globalized world. Challenges put an impetus on the African continent to further integrate its strategy to contain such outbreaks. We need to look closely at how we can, as the continent, expand the capabilities of the Africa CDC. Everyone has a Patreon page, so you can go on there and support the mission and keep us going.